Esperanza's mission is to serve anybody regardless of ability to pay. Specifically, our mission is to provide health and hope to Chicago's underserved communities. So we're really proud at Esperanza to offer the full range of primary care services. We offer family medicine, internal medicine, pediatrics, and OBGYN services. And we offer those through the services of physicians and nurse practitioners and physician assistants as well. We also offer a lot of wraparound services, and behavioral health care is a really key one of those. So we offer integrated behavioral health services at all of our sites with licensed clinical social workers and licensed professional counselors. And we also have a limited number of specialty services, including psychiatry and endocrinology.
At Esperanza, we serve anyone, regardless of their ability to pay, their immigration status, their identity, or preferred language. We primarily serve neighborhoods on Chicago's southwest side. These are predominantly Latinx neighborhoods, immigrant communities, largely Mexican immigrant communities. They are rich and vibrant in cultural traditions, and yet at the same time, they've seen decades and decades of structural and economic disinvestment. Because of those social determinants of health, we then see high health disparities in issues like adult diabetes, obesity, liver disease, and in some of our neighborhoods, infant mortality and low birth weight.
Our communities want to thrive. I see it, with the parents that come in and they're asking for resources for the youth, but they also want to be met halfway. And so I feel like that's really where health centers can come in, right? And being able to open up those pathways to create that communication, but also to create that community. Because our communities have been disproportionately impacted before by medical systems in a negative way, there is a lot of untrust, and so I think that it's important for health centers to be able to start creating that trust and start meeting community members within their own community.
One of the things that makes us unique is that we are what we call the teaching health center. So a lot of family medicine programs are based out of a hospital, whereas we like to emphasize that we're based out of our community health center, our QHC Esperanza. So because of this, our residents are kind of better able to learn how to provide clinical care within their own patient panel in the outpatient clinical setting. And because of the nature of where we are in the community that we serve, they're able to learn how to provide culturally competent care for an underserved Latinx community.
I remember my parents being a little puzzled about things. As I grew older, I'm like, why wasn't there more of an effort to explain things? Could it have been the language barrier? Could it have been that the physicians were dismissive? My dad had just retired, so they were both kind of like looking for something that was just more affordable. So then they said, they told me, we went to this new clinic, everyone speaks Spanish there, and we love our doctor. I applied to every Chicago program, and then I was like wondering, like, who's Esperanza? Like, it hadn't clicked in my brain that this is the place that my parents have been going to for like 5 years. And then I told my mom and my dad, I'm like, Dad, like, is this the same Esperanza? And I showed them the picture of the building here, and they're like, yeah, that's it. We told you, it kind of looks like a burger, like a spaceship. But then as I started looking more information about Esperanza, I started realizing everything was research-based. They've been growing. They had an amazing outreach during COVID-19 that they were vaccinating so many people and just really standing up for the Latino population. One thing that I've told individuals who are looking for a family medicine residency program that serves the Latino population is that this is what you've been looking for.